Hello, welcome to my presentation. My name is Kidist. The title of my presentation is Effectiveness of ITN and IRS in Reducing Malaria Transmission Among Pregnant Women in Alba Kulito, southern parts of Ethiopia. This presentation will focus on a review of the effectiveness of insecticide-treated nets and indoor residual in reducing malaria transmission, specifically among pregnant women in Alba Kulito, southern parts of the country. Why I'm interested in this topic? Because 2018, after a long time, I went back home and I have been asking my parents what to bring and what to pack, and they told me that it's very hard to find mosquito nets and some mosquito sprays. And I have been thinking after 2018, how it is very hard to find those stuff. So I'm very much interested on those two topics. Alba Kulito, it's in southern parts of the country, the town in southern nationalities and people region, and it's a malaria endemic region, and the area has limited healthcare access, making malaria prevention and treatment challenging. Why I focus on Alba Kulito? Because high malaria burden, limited access to healthcare, has deficits, and also there is also a research gap. The pregnant woman in rural Alba Kulito faces a higher risk of malaria-related complications, including maternal anemia and adverse birth outcomes. Many households lack access to insecticide-treated bed nets and indoor residual spraying. Low literacy rate, reliance on subsistence farming, and inadequate healthcare infrastructure contribute to poor malaria prevention and treatment. There is a limited systematic review research focusing on the effectiveness of INT and IRS specifically in this region, making this study critical for evidence-based interventions. Epidemiology of malaria. Malaria is a mosquito-borne disease caused by different Plasmodium species, with Plasmodium falciparum being the deadliest. Transmission occurs through bites from infected female Anopheles mosquito. Sub-Saharan Africa, including Ethiopia, bear a significant malaria burden. Pregnant women are at increased risk due to reduced immunity, leading to severe complications such as maternal anemia and adverse birth outcomes. The magnitude of the problem, malaria is a leading cause of morbidity and mortality worldwide. In Ethiopia, it remains a major public health occurrence, accounting for a high number of outpatient visits and hospitalizations, particularly in southern parts of the country. Beyond health, malaria significantly impacts economic productivity, placing heavy burden on affected communities and healthcare system. Underlying causing contribution factors. Several factors contribute to malaria transmission. Climate plays a key role. A mosquito thrive in warm, humid conditions. Socioeconomic challenge, including poor awareness and adherence to preventive measures, further contribute to the problem. Additionally, inadequate government infrastructure and environmental factors like stagnant water bodies support mosquito breedings. Overview of existing national or local program policies. The current strategy in insecticide-treated bed nest distribution. The Ethiopia Ministry of Health, in collaboration with global health organizations such as WHO, PMI, and Global Fund, has been distributing INT to households in malaria endemic regions. INT have been shown to significantly reduce malaria transmission when properly used. However, a challenging consistent usage and net durability impact long-term effectiveness. Indoor residual spraying campaign, IRS, is another key strategy involving the periodic spraying of insecticide inside home to kill mosquitoes. IRS campaigns are conducted in high transmission areas targeting malaria vectors breeding sites. This campaign have shown success in reducing malaria cases, particularly when applied in conjunction with ITN usage. However, logistical challenges and operational cost limit widespread limit implementation. Challenges and gaps. Insecticide resistance. Mosquito population in Ethiopia have developed a resistance to commonly used insecticide, reducing the effectiveness of both ITN and IRS. Studies showed that malaria vectors have increasingly adapted to pyrethroid-treated nets and IRS formulations, necessitating alternative insecticide strategies. Limited access in remote areas. Many rural and hard to reach communities struggle to access malaria preventive tools. Challenges including inadequate healthcare infrastructure, supply chain disruption, and limited awareness programs. Pregnant women, one of the most vulnerable group, often faces additional barriers to accessing preventive measures. Sustainability and funding constraints. Continuous distributing ITN and IRS campaign require significant financial resource. Limited fund affects coverage and consistency in program implementation, leading to gap in protection. Justification for the new approach: improve access to prevention tool, strengthening distribution network to ensure that INT and IRS reach all pregnant women, especially those in remote areas. Integrating intervention, combining INT use, IRS, and other vector control measures with a community-based educational and surveillance program to enhance effectiveness. Alternative insecticide and resistance management, exploring and implementing next generation insecticide and rotating different insecticide diseases to combat resistance. Community engagement and behavioral change, addressing barrier to consistent INT use and IRS acceptance through cultural tailored awareness campaign. Proposed intervention setting and priority population. The proposed intervention will be implementation in Alba Kulito, an area with high prevalence of malaria among pregnant women. The program will focus on improving access to preventive measures and engaging community leaders to enhance uptake and adherence. Program goal and objective. The primary goal is to reduce malaria transmission and improve health outcomes. A specific objective include increasing INT usage, reducing malaria incidence, and strengthening healthcare capacities for malaria prevention and treatment. Intervention, this is the most important part of the presentation. The proposed intervention is a community-based malaria prevention program targeting pregnant women and other vulnerable population in rural Ethiopia. The program will focus on improving access to and utilization of insecticide-treated nets and indoor residual sprayings with an emphasis on educational and behavioral change. Additionally, the program will incorporate local community health workers to provide continuous support and monitoring. This intervention will help reduce malaria transmission and improve maternal health outcome by ensuring that preventive measures reach those most at risk. Program component: distribution of insecticide-treated nets, indoor residual spraying, community healthcare education and engagement, monitoring and support system. Implementation and responsible parties: local health authorities, community healthcare workers, non-governmental organizations, and pregnant women and caregivers. Treatment-oriented prevention components. The intervention will focus exclusively on preventive measures and will not include treatment for malaria or other diseases. By emphasizing INT distribution, IRS, and community-based education, the program seeks to educate malaria transmission and prevent new infection. The approach will encourage communities and sustain prevention support independently. This strategy will carefully monitor and assess its effectiveness in reducing malaria incidence and ensuring its sustainability beyond the program duration. Implementation strategies: training healthcare workers and integrating malaria prevention into routine antenatal care service will ensure sustainability. Engaging religious leaders will help increase community participation and adherence to preventive measures. Program resource: available resource and needed intervention implementation, local resource, community healthcare workers, health post clinics, radio stations, and traditional leaders, national resource, Ministry of Health, National Malaria Control Program, international resource, World Health Organization, WHO, Global Fund, and PMI, non-governmental organizations, and resource needed: alternative insecticides, mobile clinics, and additional healthcare workers. And staffing: community healthcare workers, educators, supervisor, trainers, project manager, Material and resource, equipment and supplies, insecticide treated nets, sufficient stock for distribution among pregnant women and vulnerable population, indoor residual spraying equipment, spraying protective gear for workers and insecticides, mobile clinics equipped with necessary medical supplies, educational materials and INT distribution tools. Educational materials, flyers, posters, pamphlets on material prevention, radio and television content production for health education, monitoring tool, data collection forms, smartphone tablets for healthcare workers to track the INT usage and IRS coverage. The financial resource funding need. The estimated fund for this intervention will cover salaries for training costs, INT distribution, IRS campaign, and educational materials. A detailed budget will be provided on the appendix section. And source for fund, international fund, global fund, PMI, and WHO can provide significant financial resource for malaria prevention. The national government, the Ethiopia Ministry of Health, through the National Malaria Control, the control program may allocate funds to this intervention as part of its national malaria strategy. Non-GNO partnership NGOs with a focus on public health or maternal and child health could provide supplementary funding and resource. Community contributors, in some areas, local communities may contribute in-kind sources such as volunteers or land for the use of mobile clinics. And budget will be explained in appendix section. Success potential and sustainability. Community involvement and government support will ensure sustainability. Mobile health clinics will improve accessibility, and training program will maintain intervention effectiveness beyond initial implementation. Challenges and mitigation strategies. Insecticide resistance threatens malaria control effort. To mitigate this, the intervention will rotate insecticides and improve supply chain management to ensure the availability of essential materials. And this is how the breakdown looks like, the budget for the malaria prevention control. And my last two slides are the references that I use for this mini systematic review preparation. Hope you enjoyed the presentation, and I'm sure hopefully this is very informative and helpful to understand what's going on in the southern parts of Ethiopia, specifically the rural area in Alba Kulito. Thank you for listening.